Welcome to today's program, and thank you for joining us. I am C. Virginia Fields, former Manhattan Borough President and current President CEO of the National Black Leadership Commission on AIDS, NBLCA. The mission of the National Black Leadership Commission on AIDS is to educate, mobilize, and empower Black leaders to meet the challenge of fighting HIV/AIDS and other health disparities in their local communities. The Adolescent Program at Montefiore Medical Center is an outpatient comprehensive program for young people aged 13 to 28. They provide medical and psychosocial services to those who are infected, affected, impacted, and at highest risk for HIV acquisition. They're also a center of excellence for young transgender individuals who are seeking hormone therapy and legal support. The program has many services for youth, including PrEP, known as pre-exposure prophylaxis. So on today's program, we will speak with Justin Toro, who is practice manager for Oval Center at Montefiore Medical Center and formerly was the program manager for the Adolescent Center. And there are many similarities in terms of the work, and he's going to be able to talk about this exciting program. What it is, why we should be educating young adults about this prevention tool, PrEP. According to the Center for Disease Control, HIV in youth of the 39,782 HIV diagnoses in 2016, 8,451 were among the age of 13 to 24. 82% were youth of color. 6,848 were among young gay and bisexual men, and 4 out of 5 youth diagnosed with HIV were aged 20 to 24. These are prevention challenges for youth, such as inadequate sex education, stigma, low testing rates, low rates of condom use, and lack of knowledge about PrEP. So here to discuss these topics are Justin Toro, licensed master in social work, and I want to thank you for joining me today. And before we get started into the PrEP discussion, we're going to talk a little about yourself, and we have something in common. You received your master's in social work from Hunter College.
Yes, ma'am.
And I received mine from Indiana University Graduate School of Social Work.
Very nice.
So we are both joined together as far as the field, and I'm just delighted to have you here today and have you tell us a little about your work. First of all, talk about what you did as the program manager for the Adolescents Program, and then we'll talk about your promotion and the new work, expanded work, but continuing to work with adolescents.
Yes, so I worked at the Adolescent Program for a little under 7 years, and there we did, again, comprehensive medical care, mental health case management for young people, both infected and unaffected by HIV. Really big family support, so making sure that families are involved, because we know that for young people, having supports in their lives are really key. So for there, we just really wanted to make sure we were serving the community of the Bronx, serving those young people, doing the best we can to get those messages out there, and making sure that every young person felt respected and cared for when they went to see the doctor. Most young people don't feel that way when they see the doctor. They seem to be overlooked, they don't feel like they have a voice when they see a doctor. So, it was our job to really make sure that they found that voice, and that whenever they transitioned to adult care, they were able to ask the questions that they need to ask. They were able to advocate for themselves. So we really wanted to make sure that we empowered young people to do, to be the best selves that they could be.
So what would you say in terms of a given year, how many young people might you have seen, might have been seen doing
Sure.
that in that program?
Yeah, so
annually?
annually we saw about 100 young people each year. We were a very specialized program, so we really focused on young people. We made sure that their follow-up care was taken care of, that they were receiving their medications, that mental health support was really big. You know, as a social worker, wanting to make sure that stigma was being addressed, that disclosure was being addressed, that, you know, making sure that they understood that they were going to lead healthy lives as long as they worked with their doctors, they worked with their social workers to, you know, in partnership to make sure that they were the healthiest selves that they could be.
And what was the age range again?
Yeah, so we worked with 16 to 24-year-olds. That increased over the past few years just because young people didn't want to leave the program. You know, they liked the doctors that they were seeing, they liked the social workers, they liked the staff, they liked the space. So naturally, we wanted to make sure that we progressed and we provided that safe space for them to as forever long that we could keep them as possible.
Yeah, but seeing the numbers, as I mentioned earlier, with respect to the Center for Disease Control report in 2016, that's a rather high number for that population.
Yes.
What do, in your work, have you been able to think about? What do you attribute that to?
A lack of knowledge. You had mentioned that before. Unfortunately, comprehensive sexual education is not really provided in the schools. It's unfortunate that it's the last piece of education that's given to young people, even though there are mandates in New York City and state to provide HIV and AIDS lessons. They're not receiving it until their last year in high school, where we know individuals as young as 7th, 8th grade are engaging in sex. So the longer the messaging that people are waiting for, the more likely a young person might be able to engage in high-risk behavior that puts them at most risk for HIV acquisition.
Because we also saw, I think, a recent report, not so recent, which makes it even more disturbing, the increase of sexually transmitted infections among ages as young as 11.
Absolutely, yes, exactly. And it's exactly that young people don't understand how sexually transmitted infections are transmitted. They don't understand how to protect themselves. They understand the condom talk, but they don't understand that there's other ways that people can actually get STIs. So orally, vaginally, rectally, through urine. There's all these different ways that a person can be exposed to STIs that they don't even know that they have. Most STIs are asymptomatic. So if somebody doesn't feel a burning, burning while urination, discharge, they're not going to think oh, maybe I need to go to the doctor. And young people, we were all young people at a time, we rarely went to the doctor. If it wasn't burning or falling off, why would I need to go to the doctor for? So why we want to make sure that young people get involved in some type of primary care is that they have contact with a doctor on an often basis. So even if they feel like they're not symptomatic, they're still being checked regularly to know what's going on with their bodies. And that's something we really promoted, any clinic would promote is body positivity and making sure that they understand their needs, they understand their bodies, they understand what they like and what they don't like. And again, these conversations aren't really had all the time. We know some families are very comfortable with having these conversations. Some families, for cultural, religious backgrounds, don't have these conversations. So that's where we kind of fit in as advocates for adolescents, making sure that we provide them with this information and that support.
Okay, now you transition. You're at the Oval Center now.
Yes, ma'am.
So tell us a little about that, and what is the connection or linkage between when you were at the Adolescent Center and what you're doing now? How has that changed, or?
So very similar work. It's still community work. So the Oval Center at Montefiore, we're the sexually transmitted infectious clinic for the hospital. So we see community members throughout the Bronx, throughout the 5 boroughs, for looking at treatment and screening of STIs, HIV prevention and treatment. A lot of syphilis that we see, particularly in the Bronx. We see a very, marginalized community that has a very high rate of syphilis. And we see anybody 16 and above. 16 and up. So we have an 81-year-old, 82-year-old coming in for treatment of syphilis. So that means that well into our older years, we're still engaging in sex, and as we should. Sex is wonderful and sex is great. Making sure that educational piece is really heard for people as young as 16, as old as 81, 82, or even beyond those years.
Well, who are the 81-year-olds having sex with? Younger people, especially if we're talking about sexually transmitted infections. I mean, we have seen an increase as it relates to HIV among persons over 50 years. But listening to 81-year-olds, 70-year-olds in terms of sexually transmitted infections. Are you seeing any trends there in terms of who they are having sex with?
Yeah, you know, it's individuals that unfortunately may have lost a long-term partner that they were with and now kind of engaging in higher risk sex because they are exposed to new partners. Whether it's young, old, whoever they're engaging in sex with, people over 50 kind of got this message over the years: you don't need to worry about HIV. You don't need to worry about that. You passed the AIDS epidemic in the early 80s and early 90s.
You don't have to worry about getting pregnant.
Exactly. You don't have to worry about that anymore.
Right.
But those are things that people still need to consider, because if you're engaging in sex, you're still putting yourself at risk for anything that's out there. So it's really educating people to remind anybody, regardless, gay, straight, bisexual, black, white, Hispanic, if you're engaging in high risk behavior, you're going to be at risk for HIV and or STIs.
Define high risk behavior for our viewers in terms of how you integrate that in your work.
Yeah, so any high-risk behavior is any behavior that does not involve a type of protection. So whether that's oral sex without a condom, anal, vaginal sex without a condom, somebody that's not on PrEP or PEP, someone that is HIV positive that's not adherent to their medications, these are all high-risk behaviors that account for new acquisition of STIs and HIV.
Wonderful segue in terms of PrEP, pre-exposure prophylaxis. We've heard about that. You know, it's interesting. My office held a sort of a forum with some leading journalists, quite frankly, and we were talking about PrEP. And at one point, one of the participants said what they thought PrEP stood for, and it wasn't pre-exposure prophylactic. So it's interesting that we still have so much education to do in every area, not just the young people we're talking about, but the media in this particular case, where we want them to be able to write about, talk about, and help get correct messages out there. So tell us about PrEP, what it is, why that is important, and to some extent how that how you have seen that change sexual behavior among the population with whom you work.
Yeah, so for PrEP is pre-exposure prophylaxis. So it is a pill that somebody will need to take prior to HIV exposure. So if someone is in a serodiscordant relationship, meaning that they are a person that is HIV negative in a relationship with somebody living with HIV, then that's somebody who would be a great candidate for PrEP, to make sure that their partner is on their medication and that they're on their PrEP to avoid any possible HIV transmission. So it's a pill that's taken once a day, very easy regimen to do. It was brought from an antiretroviral, so someone that is HIV positive would have this as part of their regimen that they're taking to get their viral load to be undetectable. So what scientists decided to do was figure out, if these medications are working for somebody living with HIV, how can we translate to help avoid HIV? We don't have a vaccine yet, we don't have a cure, but this is leading us in that direction to get to a really great place where we're avoiding new HIV transmissions. So again, it's a one-a-day pill, it's Truvada, and very minimal side effects that people have spoken about, and it's really a game changer if you think about it. We know that people living with HIV, if they're undetectable, there is messaging out there, U equals U, undetectable equals untransmittable, which means if somebody is on their HIV medications, they cannot transmit HIV as long as they have an undetectable viral load. For individuals living with HIV for so long, they kind of knew that was a thing. Scientists decided to finally publish. New York City and New York State got on board with it. Other states are getting on board with it. But that's one aspect. That's for somebody living with HIV. For somebody that's not living with HIV, wanting to make sure there was enough tools in their toolkits for prevention to make sure they had the options to do so. Condoms are great when people use them. Unfortunately, a lot of people aren't using condoms. So we needed something else to make sure that HIV was avoided. So, you know, people are taking it. They are coming to see us for it and reporting really good adherence to it, which means we've helped prevent a lot of possible exposures to HIV have been avoided, which is amazing.
Among 16-year-olds.
Among 16-year-olds, 16 and up. You know, and with the great state that we live in New York City and New York State, we have the laws that protect young people. And if anyone is over the age of 13, they can consent to an HIV test, they can consent to STI screenings, but now with the change of the law, they can now consent to treatment of HIV and treatment of sexually transmitted infections, which was something that didn't happen before. So what physicians needed to do prior to the law change was kind of the under the table workings, if you think about it, because we know that young people, if they're engaging in sex, they want to be responsible enough that they can come and get tested. And if they need to be treated, they're taking the responsibility and the ownership to get themselves treated without their parents getting involved. Now we can make that known that young people, you can do that. And you don't have to fear that your parents are going to find out. Because what we see, individuals that identify as LGBTQ, they are at most risk for homelessness, displacement out of their families' homes. So if their family knows that they're engaging in sex, that they might be engaging in gay sex, they can't have those conversations. So they're worried that if they disclose this information, they're going to be thrown out of their homes.
Now, even with the laws that we have here in New York State, there still seems to be a real challenge in terms of parents or adults who are in the lives of young people, caring adults or responsible adults in their lives, not knowing and not having the right
Knowledge.
necessarily to know about whether or not their child or the person in their care is either taking PrEP or taking medication or something that they don't know about. So that is still pretty much an issue, especially in Black and Latino communities. So do you find that to be a factor in terms among the young people with whom you're working?
Absolutely. You know, absolutely. It's that fear of the unknowing what their parents are going to say or what actions may happen after that. We want the family to support the young person, but we know that, again, cultural backgrounds, religious backgrounds, they teach us what they teach us. And we don't want to change families. We understand that that's your family and that's how your family was raised and things. But our concern is the patient that's in front of us. And if their concern is displacement out of the home and things like that, we need to figure out how to get them to be healthy, to be protected, but then also how to not have their basic needs being removed from under them. And once somebody has their basic needs removed, like housing and food and shelter, they're at most risk for HIV and STIs.
So what is your process for linking a client, especially as young as 16, to PrEP?
Yep. So they come in for an initial medical visit. We do all STI screenings. We do blood work to make sure that liver and kidney functions, because that's where the PrEP pill has the most impact, is on our kidney and livers. So we want to make sure that anyone, regardless of age, their kidney and liver functions are well, that there is no signs of hepatitis infections going on, there's no acute HIV infection that's happening, and acute is anybody that was recently exposed to HIV. And as long as they are consenting and they understand the needing and the responsibility of taking it every day, we make sure that they understand that and we prescribe it to them. They come back and they see us in a month to make sure no side effects, everything is good, and then we get them on a quarterly basis. So every 3 months they're coming for HIV and STI screenings.
So they could very well be in the household taking this medication and the parent or the adult has no idea that they are taking this medication.
Correct. I'm not a parent. I do not have children, so I can only talk from the child to parent. And I've had conversations with my mother about this. And she is always kind of on the fence, like, ooh, if I've known, what would I say? But I'm not sure. It's kind of in that moment, we don't know what to say in those moments. It's the after the fact that we realize, maybe I didn't say the best thing I could have said to that young person in that moment. Or anger got in the way. Or again, education from prior got in the way. So we want to make sure that those individuals that come and see us, youth particularly, have the education that they need and the information they need to make the conscious decision. To me, and this is a personal feeling, if a young person is conscious enough to engage in sex, they need to kind of go with the responsibilities that come thereafter. And that's educating themselves about condoms, about safety, about STI and HIV screenings. It's not just we get hot and heavy and then that's it. People think it's that easy, but then there's the before, there's the after.
And some potential consequences.
Exactly. And some young people don't understand that or know that yet. And that's why we really want to make sure that we're educating young people nowadays.
So what are some of the typical kind of questions or concerns that young people express now that you've engaged them in terms of beginning to try to link them to PrEP? And I raise that because one of the things that my office did, we conducted focus groups with young black gay men roughly between the ages of, I think, 18 to 24, upstate New York and out on Long Island. It was all about PrEP. And some of the responses they gave us, I find, are the same I hear around the nation as we move around the country, having to do with messaging, believing that messaging that they see related to PrEP has nothing to do with them, but basically gay white men. Concerns about long-term use. If you're 18 years old and now you start taking PrEP, what does this mean over a longer period of time? We were very interested that many of them brought up what happened in Tuskegee.
Absolutely.
The Tuskegee debacle and so forth, that they still, talked about that. And equally as important, they talked about the fact that, well, for the most part, they did not have providers. So therefore, when they go to a doctor, it might be an emergency department situation, and not having a doctor with whom they regularly communicate or see, there is no discussion about PrEP.
Absolutely.
No talk, no questions, no incentive. So it's the lack of knowledge and fear of the unknown. So of course, we do not in our organization in Black encourage one way or the other. We provide information. I think that's a choice that people have to make. And in your work, I'm sure you're engaged with that a lot. But it's the lack of information, and although there's a lot out there, it's not filtering into the minds of this population we're talking about. So what do you think we must do? I know education is important, as you said, comprehensive sex education in the schools, despite the fact that New York State requires public schools to have curriculums age appropriate. We're not doing that, yet we're seeing these numbers increase. So what do we need to do?
So I think historically it's been very one-sided. It's been put on the patient or the consumer. We have to remember, we have to educate providers ongoing. We have to make sure that they understand what PrEP is, what PEP is, what sexual health needs, conversations need to have, how to take a very good sexual comprehensive history. We have doctors that have been in practice for years and would never want to speak about sex. That's not the type of practice that my clinic endorses, nor do many other clinics endorse. We are all about sex positivity. If you are engaged in sex, we want to know about it because we want to help you navigate the best ways to enjoy that sex. Pleasure is the key here. It's not about the condom, it's not about what happens after, it's about the pleasure that you're wanting to get out of that experience. And our job is to provide them with the most information to get the most pleasure out of that experience. And that feels consequence-free. Because we don't want, after a sexual encounter, to have that in the back of our minds, what did I do? What am I at risk for? What do I think about next? We want to make sure that when you're done having that sexual experience, you're in a nice, relaxed mood. You're enjoying yourself. You can move on with that process. So again, it's really not only education on the consumer, but provider education is really big too. We are very, I want to say, lucky here in New York City that we have providers that are educated and that provide the services. Unfortunately, in New York State, we're not doing that great of a job.
Correct.
We need to make sure that as New York City, we expand that to New York State. So I'm actually one of the co-chairs for the HIV advisory body in New York State, and that's something we're working on right now, is making sure that providers all throughout New York State are educated on this. Where if somebody is in Rochester, they have a 3-hour commute to their doctor, to and from. If they have to come every single month, do you think that patient's going to be retained in care? Probably not, because travel is a barrier. Time is a barrier. So how do we advance ourselves in the rest of New York State to get people engaged and linked to care that works for them?
And we can certainly see that in our work because we have affiliate chapters in upstate, Syracuse, Rochester, Buffalo, Albany, and even out on Long Island. And there's a very different response to these conversations and approaches than what we experience here in New York City. So for my last question, I just wanted to talk a little about the disparities in PrEP used by women, specifically African American women, that's persistently reported. So can you speak briefly about the demographics of your population and how that is addressed?
Yeah, absolutely. So like I said, we're a community clinic, so we're seeing individuals of all genders, creeds, races, religions, cultural backgrounds. Majority, we do see a lot of people of color being in the Bronx. It's interesting, as New York City and state, we failed women. And I will promote that as a personal statement. We failed women in that aspect. We put gay men of color, we put white gay men, we put gay individuals first. We forgot about women. And that is something that I think now we're seeing a lot bigger pushes to message PrEP and PEP for women. Sexual health, we're seeing pushed for women. But we were following the data, and we saw the trends in HIV was skyrocketing for young gay men of color. Now we see in 2016, there was a blip. There was a blip of women of color being diagnosed with HIV. So once we saw that blip, we had to be reactive and we had to respond, and we had to see what is the messaging that needed to be put in place. But instead, if we can go back in time, it should have been messaging for all, messaging across the board, which again, we can't put up one poster and think everybody's gonna think, oh, that's for me. But we should have done a better job in targeting everybody. People of trans experience, people of color, women, men, gay, bisexual, heterosexual, the spectrum. Everybody has sex.
And I think that had we taken that approach, hopefully we would see some different results today.
Absolutely.
Even with respect to the disproportionate impact of HIV/AIDS among African Americans and Latinos.
Absolutely.
That back in 1981, when the Center for Disease Control released its first report, what became known as AIDS, to take that approach, I think we hopefully would have seen some different results. Well, Justin, I tell you, you have been a wealth of information, and I see why you're so doing such important work up at Montefiore Hospital. So
Thank you.
We'll have you come back because we didn't even touch up on PEP, which is post-exposure prophylaxis that a person is able to take after they have been exposed to sexual activities and they have some concerns or questions. But we're going to have to bring you back
it's
for
like
that
it's
one.
the plan B for HIV.
Right. So I'd like to just thank Justin Toro for joining us today. And for more information about the program at Montefiore, you may call 718-882-0023. And to learn about NBLCA, please visit our website at nblca.org. Also look for NBLCA on Facebook, Twitter, Instagram, LinkedIn, and YouTube. The Manhattan Neighborhood Network brings these programs to you to better inform you, the viewer, about the important topics that impact your health and well-being. So please let your family, friends, and neighbors know about this program. I am C. Virginia Fields, and I thank you for joining us and hope you'll tune in next time for NBLCA's Health Action TV right here on Manhattan Neighborhood Network.